you go from topical things to having oral, like acne
So there's
medication?
an algorithm for it. And in general, I always start with a topical. Some people are very reluctant to do oral antibiotics, so I try and do a second topical if it's in that category. Some people are like, I just want to get rid of it. I try and do 3 months of doxycycline. I am a doxycycline fan just because it has that anti-inflammatory property behind it. That's why they used it a lot in COVID, for the anti-inflammatory property on the lungs so people could breathe. And definitely helps a lot with the redness. There's studies that show you can do it for 6 months with no issues of having a resistance to it, but I only do 3 months for acne because at that point, these kids have been dealing with this acne a while. They don't want to keep going to school with it. If that 3 month mark, we've saw it, absolutely no change, then we talk about Accutane, which is literally the closest cure to acne on the market.
Accutane has some potentially severe side effects, right?
It does.
And there's a lot of things that we need to do to get somebody enrolled in Accutane. Can you tell us a little bit about some of the testing that you do ahead of time and how you monitor patients to make sure that they can safely take the medicine?
So I am one of those conservative people when it comes to Accutane. I'm only going to give you what your weight allows. There's doctors out there that'll try and give you the whole dose in 3 months. It is typically a 6-month process. So you rebound hard if you try and get it all up front. So I try and tell people, this is a slow process. We're going to become friends because you're going to see me every month. There's a program that's ran by the government called iPledge that, manages this on the back end, manages the pregnancy test, the patient, all their information saying when they can have the medicine. Because in the studies, they gave these medicines a higher dose than what we typically do now. Usually when you see studies, it's like 200 times the dose that you would normally give a patient to kind of see what side effects they'll have. And I go through the list of side effects. There's risk of pseudotumor. There's risk of pancreatitis, hepatitis, issues with your cholesterol panel, which specifically your triglycerides, liver issues. You can have fingernail infections. There's multiple things. Main thing that I see in my teenagers that I put on this, chronic dry skin, obviously, because it's an oral version of that retin A that we were talking about. So oral systemic vitamin A. It is made to dry out every oil gland you have. So you're not just going to have a dry face. You're going to have a dry chest, arms, legs, back. Everything dries out, including your mucous membrane. So that leads me to my second thing, especially in the winter. When you're laying in that dry heat, people get nosebleeds because your nose is drying out. So the trick to that is I have them put a little Vaseline in their nose before they go to bed, add a humidifier in the room that they sleep in. Those little things make a difference. Vaseline for the lips. Simple Vaseline for the lips makes a huge difference from that chronic cracked. Sometimes they can get joint aches because they're getting dehydrated because it's drying out everything. Headaches because they're dehydrated. It's drying out everything. They really don't do pregnancy categories anymore, but originally it was a pregnancy category X, which means you cannot get pregnant on this medication. It can cause birth defects. It can harm the fetus. It could kill the fetus. So we have to see those female patients every month, get pregnancy tests every month. So again, this is a very safe drug when you are seeing these patients every month, monitoring their levels, monitoring their side effects, adjusting as needed. Now, I will say I've had 2 or 3 patients that I've had to take off this medication because they've had some of the worst category side effects, which are suicidal ideations, thoughts of wanting to hurt themselves or somebody else.
I mean, it's already hard being a teenager, so you can imagine that's definitely something we need to keep an eye on.
Yeah, and a history of inflammatory bowel disease, it can actually flare that up. It can actually cause issues with night blindness at high doses of vitamin A, which is, again, why I kind of just stick with the good gold standard of giving it by your weight. It's usually 120 to 150 mgs per kg on these people. You can go as high as 200 if they have a lot of chest and back acne, but I don't go past that.
Wow. I had a lot of friends that were on Accutane as teenagers, and it's really interesting that there's just so much behind it, and the iPledge is really important. And everything is teamwork in medicine. So it's not just the medical doctor, the PA, the provider doing the right thing, but also the collaborative team that works with it. The parents are part of that team, the teen themselves in trying to self-report some of those, because I can imagine for a teenager it's really hard to basically tell their parent or to tell you, look, maybe this medicine makes me look better, but now I have all these thoughts that I never had before. It's a time in their life where it's hard. They're going through so many things, right? So it's good to be able to spot that and to know your patients really well. And that goes to your first setup, that you're working with them for about 3 months on things that are a little bit less let's say intrusive or have less side effects, so that you
Correct.
get to know them and, develop that relationship. And I also have heard of pharmacists that have alerted families and that they make sure that the patients have signed an I pledge. And they're also part of your team. They're not just there idly providing you a medication. It's good that they're also doing that back check too.
And that's another reason they said, do you want to speak to a pharmacist when you pick up some of these medicines? Because they'll come out there and they'll give you some extra warnings. They're like, make sure you drink enough water. If you take it on an empty stomach, you're going to throw it up. Like those good things on having that care team. Even like additionally, like I send my patients for labs. We don't do labs in our office. I send them to LabCorp. So LabCorp handles my other stuff every month. They have to get labs every month. I check their liver, their kidneys, their white blood cell count. I check their lipid panel for their triglycerides to make sure they're tolerating the medicine well. And if we see any abnormalities, I'll get labs again in another couple weeks. We keep increasing. I either lower the dose or take them off. So that's where my collaborating physician comes into play, Dr. Vinorni. So me and her will sit there and we'll lay their labs out and we'll talk about adjusting doses, stopping patients, restarting patients. Again, I've only had to take 2 off because of the other issues. But outside of that, Accutane's a really good medicine.
Yeah, it really is. On the plastic surgery side, something that's very interesting about it is that because of the way that it suppresses the oil glands adjacent to the hair follicles, which is where a lot of the stem cells come from the healing standpoint, we used to be told, at least when I went through training, that we would need to stop that medicine for many months.
Yes, so they recommend don't do anything to your skin, piercings, tattoos, surgeries for like 6 months after you finish, because you run a higher risk of issue with scarring in general, because it's drying your skin out so much that your skin's thin and it's not going to heal well or rejuvenate well.
Right, correct. So the main patients that I have that come to me with, let's say, acne problems, come to me because of cystic acne that hasn't regressed, and they have one cyst here and something there. And I rarely have trouble with those patients, but we always ask, are you on Accutane? How long have you been off of Accutane? And there's some plastic surgeons that say that 3 months for minor procedures might be fine. But if you're having something to your face done, rhinoplasties, eyelid surgery, that will change, or something a little bit more involved. So make sure to communicate that to anyone else that might be your provider, a primary care doctor, any surgeon, so that as a team, we can make sure that you're well taken care of and you don't have any other sequelas that are unnecessary, because we could hold the medicine, just delay things on the elective realm. I mean, if it's an emergency, then all things out of the water.
And that's where the knowledge of the plastic surgeon comes into play, because I actually have one patient on Accutane that her mom randomly told me she's scheduled for a breast reduction in a month and a half. And I was like, well, did you tell them you were on Accutane? She's like, oh, yeah, they said it would be fine. No. I think you need to re-ask, double check that they actually heard that you were on Accutane, because again, at higher doses and your skin's drying out more, you run a risk of issues with scarring, and it was a full breast reduction. That's a good bit of scarring.
Yeah, it's a big operation, and with a lot of scars and a lot of incisions involved. So I'm, again, more conservative. I rather just outweigh the risks and benefits. Sometimes the patients understand the risks, or at least they want to assume the risks. But that doesn't mean that it's going to be easy getting through the process.
Right.
There's a lot of hand-holding that can happen if scarring doesn't heal, if the skin doesn't heal well, if you have excessive scarring, that maybe could potentially be prevented. So, that's, I guess, my surgical 2 cents there. And every now and then I'll take out a cyst from a patient's face or back, or something that hasn't regressed completely. But we have so many good medical treatments now that it rarely comes
to that point.